patient doesn't want a doctor who has to sit and pray on what to do next. They want a doctor who knows what to do. A doctor can take control. I learned a lesson in Pennsylvania years ago, decades ago actually, on patient control and patient management. We had two medical doctors working for us, and they wanted to do EMGs, which is not a pleasant test, EMGs and NCVs. It's where you're actually putting needles in people and shocking them a little bit and reading the amount of charge that comes out of that. But you learn a lot about their nervous system. So we had one doctor that was doing it, and people loved him. They're like, oh, I had one of those before, it was really terrible. And I don't know why, but he made it really easy. And then we had the other one who was also a minister, a Pentecostal minister. He was a great guy, very spiritual, and people hated it. And they were like, don't ever put me in a room with that man again. And I'm trying to figure out, well, what's the difference? So I went in and watched how they did it. The one medical doctor was very expeditious. He talked to him the whole time. He kept moving, never stopped talking, just did the things he had to do and said, okay, here we go, ready? Boom, and he'd hit the button and people, oh, I felt that. And then I went in with the guy who was the minister, and he was going like this. He was wearing the wrong hat. He was wearing his minister hat, and he'd put the electrodes on, and he'd zap the patient, and he'd consult with God, and he'd look up, and he'd be thinking, and he'd make some notes. And then he'd do another one, and it took him 3 times as long to do the test. And the patients hated it because they didn't think he had certainty. And I remember I had to tell him, hey, doc, listen, I know you're a minister, and there's a time that you have to be a minister and consult with God on things, but not when you're with a patient. A patient doesn't want a doctor who has to sit and pray on what to do next. They want a doctor who knows what to do. A doctor can take control. What I started putting together is these patients are coming in with their health totally out of control. And what they were looking for is a doctor who could control their health and not be their friend and not do everything to make them feel warm and fuzzy, but actually saying, this is what we're going to do. This is what we need to do. This is how we do it. It's going to be a little unpleasant. Let's do it. Boom, there you go. Is that all right? Can you handle that? Good, let's do it again. Let's do it again. And it was an amazing difference. I learned so much from those 2 doctors watching how they both did the same procedure and how it was perceived completely different by the patients. So if you're a doctor, if you're a chiropractor or a physical therapist or a medical doctor, whatever kind of doctor you are, you have to realize those patients are looking for somebody who can control their health. And they're going to resist at first because they don't want to give up their health problems to somebody who can't control their health. So you have to be confident enough in what you're doing and knowing when to be able to accept that patient and when you can't accept that patient. But when you can accept that patient, you need to be totally confident and tell them this is what you need to do. And if they don't want to do it, you should say, I apologize for not being able to explain to you that this is what you need to do in such a way that you would do it, because this is what you need to do. And I'm telling you as your doctor, not as your friend, you need to do this. I want to help you. That's what people are looking for. And when you start to do that, what happens is patients start thinking you're the best doctor they ever met because you are responsible enough to make the right decisions for them.